Yes, how are you farmers? Actually, let's say that it's another time. I'm very, very happy man because actually Eugene Poultry Farm Limited, you have supported us farmers. We are so grateful for that. Also, kwa saa hii nimetamani sana kufundisha wakulima because nilikuwa nikienda seminars, tukitembea kwa seminars nyingi sana, tukifundisha watu kila county. Saa hii sasa nimebidi, I've decided now to put up an online training. Like today we are going to tackle coryza, infectious coryza. Tunataka tujue mbona kuku zetu zinafura macho, mbona kuku zetu zinatoa pus cells in the eyes. So wakulima leo tunaenda kujua. Mimi naitwa Dr. Eugene, CEO Eugene Poultry Farm Limited. I'm sure mwenzangu anaweza akajiintroduce.
Hello farmers, welcome again. May I repeat by introducing myself, because I have been introducing myself in the other videos. We've been interacting. My names are Alex Muita. I'm a veterinary by profession. I work with Eugene Poultry Farm, the poultry veterinary department. So welcome to this session, and today we are going to talk about infectious coryza, as my CEO has said. So I welcome you all.
And before all, let's sanitize first.
Yes.
Sanitize is key.
As per the COVID-19 protocol.
As per the COVID-19 protocol.
Thank you.
As per the COVID-19 protocol. Sanitize. So wakulima karibu sana. Vet Alex, karibu sana.
Thank you, sir.
Yeah.
Yeah.
So we can begin. Tell us coryza.
Yes, mostly farmers have been hearing this term as from the beginning. You know, it has been a complication to many farmers. Let's say around Nairobi and other counties. We are covering around 38 counties. And coryza has been one of the factors that are leading to us being confused about how to rear poultry. So first, let's talk about coryza. What's coryza? When I talk about coryza, coryza is a term that has been used from the past by these poultry farmers. It covered all the respiratory illnesses, including mycoplasmosis, including fowlpox, including CRD. This is a chronic respiratory disease. But now today we are going to talk about infectious coryza. Yes. So infectious coryza is a respiratory bacterial disease which has affected so many farmers. It is not well known about its cause, but every farmer knows is that it's caused by a bacteria. But today, let's focus on the ways on how to prevent that disease, the treatment, how it is caused, the way how it originates, and how it affects our birds. So let's start by talking about the cause of coryza. Coryza, mostly in our farms, is caused by how we handle our birds. Let's start by biosecurity. One bird may be affected by coryza because coryza can be acute. Of course, mostly coryza is acute, but sometimes coryza becomes chronic. Kwa wakulima wenye hamuelewi, acute inamaanisha hiyo ugonjwa itakuja haraka na pia itachukua muda mchache ikuwe imeenda. Chronic inamaanisha inaweza kuja polepole hata usigundue kwamba hiyo kuku ina hiyo ugonjwa. Lakini uchukue hiyo kuku uiweke kwa zingine zote zigonjeke, na siku moja ukikuja kugundua utapata zimedevelop, zimeenda kwa stage nyingine.
So unamaanisha kuwa hii ugonjwa ya coryza hii ni ugonjwa yenye kuku zinafura macho, si ni kweli?
Ni kweli.
So zikifura hii macho, unapata kuku imefura macho kabisa, inafunga hii macho moja, alafu ingine pia inakuja inafunga, si ndio?
Kabisa.
Na umesema cause ni bacterial infection.
Yeah.
So kama ni bacterial infection, inamaanisha kuwa from my view of point, bacterial infection it can be prevented.
Very good.
Because from my side of medicine, because I'm a medical doctor, so from my side, as I understand the term bacterial infection, that one can be preventable.
True, Daktari.
So now, can you tell us more about this? How does these bacteria come into the poultry house up to it invade these birds and then get that way?
So after the bacteria develops, you will find that this disease utapata kwamba mostly morbidity rate yake iko very high. Passing morbidity ni kumaanisha ni ile transmission kutoka kwa kuku mwingine kwenda kwa mwingine iko very high. Utapata kwamba kuku akienda feed ile chakula yenye yule wa coryza amefeed, utapata kwamba huyo kuku anapata hizo germs za bacteria, na utapata kwamba huyo kuku akipata hizo germs kuzipitisha kwenda kwa kuku mwingine ni rahisi, lakini though mortality rate yake iko very low, iko up to 20%. So utapata kwamba kuna signs ambazo unafaa kuangalia kwa kuku wako ukipata kwamba kuku wako ako na coryza. Coryza utapata kwamba inafanana na magonjwa zingine. Kwa mfano nikisema chronic respiratory illness, watu wengine wataconfuse fowlpox na coryza, lakini kuna symptoms ambazo coryza iko nazo ambazo hatujawahi ona kwa fowlpox. Watu wengi mnajua kwamba in infectious coryza the first symptom is swelling, facial swelling, not necessarily only eyes but facial swellings. Facial swellings affects uso. Ikivimba utapata kwamba the wattles, hizi vitu mbili unaona zimehanga hapa hivi, zitavimba, na pia macho moja itavimba, na ikivimba itaanza kutoa usaha, pus, na hiyo pus inanuka. So ndio tunasema kwamba ukisoma sehemu imeandikwa kwamba purulent discharge from either it can be an ocular source ama inaweza kuwa from the sinuses, nasal. Yeah. So another symptom, the swelling of the eyes. Tulikuwa tumeongelea, si ndio? Macho ikivimba, usiwahi ona kuku amefunga tu macho udhani kwamba ni coryza. Macho ya coryza ikifungana inafura. The second symptom itakuwa kwa hii njia ya kwenda kwa respiratory, the breathing system. Utapata kwamba hapa kwa trachea utapata kitu kama makamasi hivi, mucus. Hata ukifungua huyo kuku mwenye amekufa na coryza, ukimwangalia kwa ndani utaona kuna makamasi iko kuja huku juu. Alafu another symptom tunaongelea sneezing. Watu huwa wana differentiate between sneezing and coughing. Kuku mwenye ako na coryza does not cough. Alafu another symptom ni difficulties in breathing. Hiyo term wanaita dyspnea. Yeah, dyspnea, very good. Yeah. Yes, daktari. You know daktari knows this thing. He's a human doctor.
Yeah, when it comes to those ones I know them very well.
Yeah, so difficulties in breathing.
So now to mean that now when the cuckoos have got they have got dyspnea, let's say the difficulty in breathing.
Yes.
And then also you find that a chicken is presenting with a whole facial expression of the face. Yeah. It's swollen. Yeah. And then also the eyes also are swollen. Yeah. Producing some pus cells inside the eyelids.
Yes. Very good.
I'm sure that one is the best English we can use here. Yeah. Because I can combine medicine and poultry. Yeah. So now to mean that one we will say it's coryza. Yes. But do we have the specific causes of this coryza thing? As per your department.
As per my department, the specific cause is a bacteria. Lakini there are so many causes. In fact, kuna predisposing factors that can cause that disease very fast. Going to that, if that chick ama that bird yenye uko nayo had another infection of the respiratory system, it's very easy for coryza kuingilia hapo. Sana sana ukiwa umeweka kuku wako sehemu ambayo ni chafu. Ndio maana huwa tuna advise farmers, these wood chippings that you do, these poultry houses, always make sure that you observe clear and very conscient biosecurity. Inasaidia sana. That one even daktari do talk about it.
I'm sure can talk farmer. Also at that one. When it comes to the cleanliness, let's say cleanliness, one Alex. Yeah. Actually, we can share ideas, yeah. Because also I've got that nini. So when it comes to cleanliness, I'm sure what one Alex is saying. You know, some poultry houses you cannot even sit in those houses. Why do I say so? It's because the houses are smelling very badly. You will get that a farmer is using the drinkers to give the water to the chicken, but you get that those waterers, they are just placing them anyhowly, and by the end of the day, those wood chippings, when they are there, when you don't turn them, when you don't turn those wood chippings, you'll get that they turn to be cakes. Now down the cakes, then now there will be so much secretion of ammonia which will come from those ones. So I'm sure the best way to do it, if you are using the wood shavings, make sure that you sieve those wood shavings well. After you have sieved well now these wood shavings, I'm sure you place them in the brooder, and if you place them in the poultry house there, make sure you turn them daily. You can use a fork jembe to turn those wood shavings, and then after at least 3 weeks, you should do a routine fumigation in your poultry house. We have got best drugs which you can use in fumigation of your poultry houses. We have got Ultracide, we have got Norclens, we have got you can name them. There's so many, but now that one, it's for the routine one. And then also another advice which I can give them when it comes to biosecurity measures, make sure at least in your poultry house have a foot bath. You have heard of cross infection. Mr. Alex is speaking about cross infection. There is a very high rate of cross infection in this chicken. Why am I saying so? This condition, it's a respiratory disease, to mean that when that bird breathes, there is circulation of air in that house.
Yes.
If there is that circulation of air in that house, what does it mean? Even the fresh birds, those birds will get infected with the disease. So to mean that the best one, make sure you put an isolation room very far from your poultry house, so that that isolation center should be very, very much away, whereby other birds cannot access there. And then also, to add on that, the issues of biosecurity, there are only 4 things which you can observe and you become a very successful farmer. I'm sure, Mr. Vet, if I go wrong, just correct me, because from that department, it's only that I'm doing the extra studies.
No, you are all right.
Yeah. So if I'm wrong, just let me know. There are only 4 fundamentals which you can have in your farm and have a successful farm. 1, maintaining cleanliness of the feeders and the drinkers, and also making sure that there are food bath there, whereby you fumigate yourself and go to your chicken house. Number 2, proper housing. Your house should be well prepared. Your house, I'm sure we will bring that topic of house, we will bring that topic on housing. I will tell you all the features of a good poultry house, I'm sure, in our next episode. But meanwhile, when you have the best poultry house, and then also the wood chippings are very clean, you'll have no sick bird. And then also you should observe vaccination. Visit our channel, Eugene Poultry Farm Limited. Search for the word vaccination. I'm sure you can get the protocol on how you should vaccinate your birds, because that lesson also I will combine it with the housing part. So farmers, make sure that at least when you maintain proper feeding, you maintain clean water, and you maintain also clean litter in your poultry houses, I'm sure these issues of coryza, you'll not have it. Actually, it's cleanliness. That is what I can say as per my view of point.
Yes. Okay. Now, let's talk about coryza. You know, now we were talking about we do not have coryza. Daktari was helping you how to stop coryza. So let's assume now you have coryza in your farm. These are the following protocols that you should follow to make sure that you either do away with it or you just reduce its infestation. So first, make sure if you notice there is coryza in your farm, those birds that you're suspecting to be sick, just eliminate them out of that room, separate them to a separate place, then do something that he has said, fumigation. In fact, that bacteria that causes coryza cannot survive in the environment for more than 5 minutes. So that means if there was cross infection, there was infection due to direct contact, feed, water, it will help when you fumigate that house. So when we talk about treatment, there are a variety of treatment measures that we are doing. Everybody knows that once every bird is sick, a vitamin is needed. That one you know. That's for maintenance. In fact, it boosts the immunity. But we have medications like tetracolivit. Daktari knows about a medication known as Probeta N. In fact, you cannot use Probeta N to the eyes if kama ujaona imekuwa infected. So you use tetracolivit. Tetracolivit is very good. There are a variety of, in fact, if you use a drug that contains tylosin, it is also very effective. But tetracolivit is always good. You mix with amylite and also Probeta N if you realize that the eye is swollen. Na kuna wenye, those professionals wenye mnaweza mkatoa pass in that eye, kuna a good way. You need a clean cloth. Si tunachukua nguo yote niko na germs tena unaenda kuiongezea kwa macho. Unachukua a clean cloth, unaenda unaifinya pole pole. Be professional. If you're not professional, call a vet. Then after there, administer Probeta N. That's what.
So I can speak about that one also, Mr. Alex. That one is as per your vet's view. And this one also as per my local man's language view. Because to me, I've been managing coryza in my farm. If you ask me how I've been managing them, actually, I've been embracing the tetracyclines. The broad spectrum tetracycline are working very well. But in our choice, Eugene Poultry Farm Limited, we are emphasizing on tetracolvit. Because the tetracolvit, actually, I was proven by one of the ultravetis team. We were partnering with them. They convinced me that tetracolvit is working very well in coryza management. I just decided to have a taste of it. Actually, it turned to be the best. So to mean that when now you are giving that tetracolvit in the drinking water, to mean that now it will be fighting both the gram-positive and the gram-negative bacterial infections in that chicken system. So to mean that either if the bacterial was gram-negative or gram-positive, it will do away with it. And then also now, you'll get in a situation whereby the eyes of your chicken are swollen. So farmers, that thing is very, very tough. That the way to go in that case is, it's very simple. Use money to get money. You can go and buy a cotton, a very clean cotton. So you decided to invest. If you cannot get a cotton wool, you can just use even a very clean cloth, whereby you buy the surgical spirit, or they do call it methylated spirit. The surgical spirit, when you dip the cotton inside, and then now you use it to swab inside the eyelids, removing that pus. If you swab there, remember that thing, it's an antiseptic. In case there was any germ outside there, and also at the cloth here, you will find that it will eventually die. So to mean that when you rub and remove that pus inside the eye, what will follow now? The eye is clean, but it's inflamed. Imevimba bado. Utafanya aje? So it's why we do recommend for Probeta N. The Probeta N has two combined drugs. When it comes to drugs, I'm sure they are good, because the Probeta N, we have got the betamethasone, and then also we have got the gentamicin combined in it, or another drug. So to mean this way, when you have this genta, it's an antibiotic. It will treat the eye infection in that eye. And this betamethasone, it's also a broad spectrum steroid. You cannot compare it with, actually sometimes it's an antihistamine due to the reaction of the disease. But actually, the main core of this betamethasone, it will help you in the aid to remove, to get rid of the inflammation. So once the inflammation is going, the eye will be opening slowly. Remember, the eye is opening, you are treating the eye, and also the whole system, it's taking tetracolvit. Why we are recommending at least amylite? Because amylite, it's very strong. Even if you realize some chicken poisoning, just use amylite. Amylite is very, very strong. You can't compare it with the other ones. I tried amylite, I tried tonafos, but I've come to realize amylite is doing good. So the amylite, it will help boost in appetite of this chicken first. Because the chicken is sick. It has no appetite. So where do you expect them to get appetite? So it's why we give them. It's why we give them the amylite. And then also, amylite is an anti-stress agent. Because these birds are depressed due to the disease. So now the anti-stress agent will get rid of it.
Daktari is emphasizing on tetracolivit is because tetracolivit carries 3 agents. It has a tetracycline, colicit, and it also got vitamins. So even if you use tetracolivit minus amylite, you will be safe for your poultry. Because tetracolivit is sensitive to those bacteria, and it also treats a variety of diseases, including even salmonella, anaplasma, so many. So you can use tetracholine to clear the whole of the respiratory system, and you will help that kuku very well. So nivo daktari.
So to conclude, actually I'm very very happy today. This is our just episode 1 in our online training. So kindly farmers, keep on following. Our next lesson will be on housing, and then also another one will be on vaccination. Housing stroke vaccination, we will just handle it as one. This one has been long because inawasumbua sana wakulima. Kindly remember to subscribe to our YouTube channel so that you can be getting updates, and click that notification bell down there. At least itakuwa sawa. Na mkumbuke kusanitize na pia mkeep distance. So Mr. Alex, tunashukuru sana.
Yes, tafadhali sana farmers, msisahau kusubscribe. Finya ile bell iko huko. Get notified kwa sababu tuko na mambo mazuri sana ya kushare. We are teaching our farmers. The deal is not money. It's about capacity building. So thank you for your time.
Thank you for your time, and then also hapo chini comment hapo chini tutoe makosa. Kama tulifanya makosa sehemu, turekebisha hapo chini kwa comments. We will be so grateful. Subscribe. Thank you.
Pleasure.
Sawa bwana daktari, naona unapambana kabisa. Sawa, fanya research, simuona hata mimi niko hatari. Thank you.